All right, why don't we go ahead and get started? I got ready to say good afternoon, but we still have an hour to go. So I think I'm ready for lunch. I don't know about anybody else. But good morning, everyone, and welcome to today's Community Care Coordination Team Work Group meeting. I do want to thank you all for your participation today and just remind everyone that this meeting will be recorded for note-taking and reference purposes. But again, just thank you all for taking the time out to be with us today. I'm going to go ahead and share my screen. Is everyone able to see?
Yes.
Yes.
Thank you. All right. So I'm going to just briefly review today's agenda. So after our welcome and our agenda review, we're actually going to participate in a very brief icebreaker, but we're going to do so in the chat box. So that way we have plenty of time for our continued discussion around defining community. But before we jump into that discussion again, we will have our very own Dr. Carter share a bit more about how we got to this point of defining community and why it's so critical to do so as care coordinators. And then after Dr. Carter gives us a bit more context, we will then have our lovely Tornisha guide us through our facilitated discussion for today. And then we'll just end today's meeting with some community announcements. I have some to share. If you all have any that you'd like to share, that would be the time to do so. And then we will adjourn. Sound good? Ready? All right. So our icebreaker for today, again, we're going to respond in the chat box, but if you could write your name, your organization, and then finish the sentence, I know it's autumn when. And even if you don't have a way to finish the sentence, if you could still just put your name and organization in the chat box, because this will also be our way to kind of count for attendance today. So I'll leave this up for a minute. Just your name, your organization, and I know it's autumn when. Finish the sentence. I can't see the chat box, so I don't know, Taylor, were there any that kind of just came in that stick out to you that you want to share? And if not, that's okay too.
No responses just yet to the prompt. Okay, here they're coming in. Okay, so Jay said, I know it's autumn when I need to grab a shawl on the way out the door. Very fair. We here in the office, it is freezing, so we now have to keep a shawl on our desk. Caitlin said, when I see candy corn in the store, and that is her guilty occasional pleasure. Tornisha said, when the leaves change yellowish orange. Judy did a call out to the fall soaps. Dr. Carter said, I start feeling aches and pains in my joints.
Good. Yeah. I love it. All definitely indicative of changing seasons for sure. Well, thank you all for participating in that. And again, if there's anybody that's just come in, if you could just write your name and your organization in the chat box, that would be greatly appreciated. All right, well, let's go ahead and move on. Dr. Carter, I'm going to turn this over to you. Would you like to begin our conversation today by sharing some context with our work group?
Absolutely. So I know last week you all discussed, and I'm sorry I wasn't there, but I know that it was you had a discussion about the definition of community. And the reason this is so important, in particular, it's important to me and and this organization and people like us who are really interested in making sure we know how to activate the community so that when we do have projects and when we do have tasks to do in the community, that they can actually get done and sustain. So in order to do that, we realized, I know in our work at the health department, and that to activate the community, we needed to understand its definition. And it's clear, it's very, very clear to me that communities don't lack expertise. What they lack is this sort of lack of organization in the community that allows it to communicate the expertise in the community to the other community members and for the community to express itself to people who are outside of the community, but control their resources and also have their own expertise that can contribute to the ongoing maintenance of the community. So there's no structure there. So when we go into the community, we we actually don't have a specific way, and we don't have a specific infrastructure that helps us keep the community activated. And the reason we don't have that is because we don't have, when we create projects, we don't put the trust and the communication as the core principles that we have to abide by and know exactly the definition of the community that we're serving. So that's why it's really important, I think, for us. Our goal here at the CCCT is to activate the community, to be able to get the community to become healthier, and for the community itself to sustain itself without us having to go begging to the federal government every year or whatever. We know that if we start something, it'll stay there. Now, in order to do that, then we have to be able to work with those key leaders who actually are the opinion leaders and the trusted voices in those trusted networks. So they have to be identified. And we do this actively. We go straight to them, but we don't have a system to put them in. So we ask for their help. We tell them about this project, et cetera. But how they feed back to us, how those informal networks of people in that trusted network, how they shape their norms. We don't identify those. We sort of come in with our own way of thinking. But those informal networks who shape the norms, they drive the behavior. And those opinion leaders help shape those norms. And at the end of the day, the local champions who mobilize the membership, who understand how to do how to maintain the feedback loops that need to occur so that a project or an implementation can be sustained. All of that has to work in tandem. And so the absolute priority for any project is trust and communication. You go to the next slide. That is the way that this really happens in a community. Once you define all of the stakeholders, understand who the champions are, and then be able to implement projects that will sustain itself over an infrastructure that we create based on trust and communication. That's the only way you're going to have effective interventions. And if you don't have right now a way for two-way communication in a community, then the community is not working with you. I mean, you're just going in and imposing things on them. You need to have two-way communication so that the community itself can be a co-creator. And because it's a co-creator, that feedback that they give to you in real time allows you to be very responsive to them. Instead of saying, we're going to do it this way, and we've got these people who come in and do X, Y, and Z. No, you've got to be very flexible, get that feedback, make the tweaks that you need to make in order for that community to be not only activated, but then be proactive in how it takes care of itself. So that's the foundation for why we are going through this exercise, because in the future, going forward with the CCCT, we want to be sure that we use these principles as our bedrock principles in order to get our communities sustained. So that's the context. That's sort of the background for where I think we need to go at this time.
Great. Thank you, Dr. Carter. Any initial questions, initial thoughts from the group before we move on to our discussion?
Okay, so good morning, everyone. So we started our last meeting discussing communities trust, talking about trust and communication. And so thanks, Dr. Carter, for providing that context information. Also, I just wanted to kind of recap what we talked about last month as well. So we talked about trusted networks. So it was mentioned during our meeting that some of the partners often view trusted network as the resources and organizational relationships needed to deliver services rather than just community-based groups such as faith leaders, youth sports teams, and parent groups. Also, there were some misperceptions that we've seen where participants noted that community members, such as the churches, sports teams, or parents, will likely answer the trusted networks questions very differently from like our community or us asking questions. So there was some type of disconnect. We also noted that many partners see the CCT as a trusted network, joining primarily to learn available resources. So we think it's important to continue this discussion and to really focus on trusting the community and also having that two-way communication. So now we're going to proceed with additional questions that we didn't get to last week. So Shanae, if you mind just going to the next slide. So we'll continue discussing building trust through care coordination. And so one of the first questions we'd like to discuss, and please, we want this to be very interactive. So please, provide your input and your feedback. So the first question is, from the perspective of care coordinators, what does trust look like in your practice? So anyone brave enough to start with this question? Or I can call on someone. I don't see any hands. So, okay. So, Judy, can you tell me, from your perspective, how do you see care coordinators and what does trust look like in practices?
Well,
And I know
again,
you work with a lot of practice, from the hospital.
Absolutely, ma'am. Yes, ma'am. As we think about the and when to me when practices means a primary care practice, right, or even any physician practice, or I shouldn't even say physician. I want it to be provider, because we work with a spectrum of folks. And what does trust look like? And it's really interesting because I even had a conversation this morning with a rural health um, program here in Western Maryland, and talking about how the patients will trust their providers. They many times trust them almost more than anybody else, right? They look to them for information, they look to them to guide them. And so when we look at that, patients need to know that the provider's taking the time to listen to them. And that includes having, and we've learned a lot with Prevention Link, and I'm sure with the other programs in the county too, but we've learned a lot around the social determinants of health, those, and however we're going to phrase those things going forward. But those challenges that patients meet across different sectors, across different ethnicities, across different pieces. But the fact that a practitioner, a practice, it's not just the provider, but what is the MA? What is being happened when that patient comes in that door, and how are they being treated and respected? Are they, if they're over, if they have an obesity issue, is that also being are they being respected? And I'm learning so much as we read through, and I know my focus is around diabetes right now, but as we read through, the American Diabetes Association has started, there's now the American Obesity Association, and of course, because there's the strong connection between the two, but it across the board, it's a matter of respect. Is everybody in the office treating the patient with respect that they deserve and do? And that's hard. We get very busy in our days and we have so much that we have to get done, but it really needs to be part of clarity, from my perspective, to make sure that that happens for the patients, that they are being respected by the provider, by the MA, by the front desk person. And then that even I feel, and I think we have a lot to learn, but I also even feel as we're working with some of the MCOs and other insurances and see where they stand on all of this. So that way we can listen to them and incorporate them in the discussions. Sorry, long comment there, but just that's where I'm at the moment.
No, thanks, Judy. And I think that's important to know that, some patients build a relationship with their providers and trust their providers. So make them comfortable. And we see that a lot too with, like, as you mentioned, preventionally, like when sometimes when they do the outreach just from the patient registry and they call in the patients to be like, no, I really need to speak with my provider first to
Yep.
just verify to get more information. So that relationship is important. So thanks for sharing. I see Mike hand is raised. So Mike, you can come off of mute and definitely answer the question or provide feedback.
Thank you, Tanisha. I would like to add on what Judy was saying. Trust is also about the expectation of our community. Did we meet their expectation? I don't say that we have to solve their problem, but when they come to us, do we have enough things to give them so that they have a response to their problems? I was always discussing this with my community health workers to say, hey, someone might have this need, but the way you respond to them, even if you don't give them the direct solution, can build trust. So it's they come to you because they want you to give them something to respond to their problem. So the way you interact with them, the way you treat them is also part of building the trust, the response you are talking to them, the communication and listening to them. So it's sometimes they'll say, don't go to that because you'll never have, your problem. You'll not have a clear response to your problem. How do we direct them? How do we refer them? Do we say that, we don't provide this service? Or you say something like, okay, I don't have anything for now, but I will look and then I'll come back to you. Do we also come back to our clients so that they know that you care about them? So I think this is more important. It's at least when they come to you, they go back with something positive, that will help them continue to solve their problem.
Good point, and we did see that as well. I think it was Magali, one of the CHWs. I think it was Magali. I know she built like relationships with the patients when she was at family medical counseling. Like if the first assessment when she did, if the patient had issues with food insecurities, and she helped them, and they felt like the trust, and she cared. So when it came into another problem, say issues with like paying their utility bills, they felt comfortable reaching back out to her, asking for the assistance, because they really built trust and, a relationship with the CHW. So thanks, Mike, for sharing. Thanks, Judy. Would anyone else like to answer the question?
I will
Can
quickly
can
interrupt,
I,
Tanisha.
go ahead, I'm sorry.
I was just going to ask, we do have an MCO with us. I see Crystal is from WellPoint. I'm curious, any reactions? Judy was mentioning that she's curious how the MCOs, where their stance is on trust and practices and delivering care and coordination and care coordination. So curious if Crystal has anything she'd like to add.
Yes, definitely love to hear from.
I think she may have actually dropped off. So Dr. Carter, I will turn it back to you.
No, so what I would want to do is if you could go back to that slide where it says key stakeholders in community. And so like taking the example of a practice who is basically they are opinion leaders and trusted voices. Those are the people who interact with the community. They are part of some community, but the patient who came in to see that doctor is part of another community. It's a part of an informal network. Those people, like, when you go see the doctor, you see them, they see you, you trust what they say. So that's a source of information. But then you go back to your informal network. Your informal network, for example, could be You're the Mayan community. So your informal network are your people in your Mayan community. And they have a doctor who is an opinion leader, who their voices they trust. But in their informal network, this is where they shape their norms. So what we have to do as CCCT is help these opinion leaders interact with the people like in the informal network so that we can drive behavior change. You see what I mean? So if you just go to the doctor and you trust him and you learn about your diabetes, but the doctor is not interacting with this informal network in a bidirectional way, getting feedback, then the doctor is really not helping to drive behavior change in that community. It's just they're giving you specific information about your need at the time. But we've got to transform that. We've got to transform that so that we cannot, so that doctors, how a doctor practices, and not specifically the doctor, but the practice, because it may not be the doctor, it may be other big entities in the practice, but they need to understand how to, and there needs to be infrastructure built. That's what the CCCT has to do to allow practices who don't have the time to do a lot, but we need to be able to get enough from a practice so that it can help these informal networks, like in the Khmer community, drive behavior change. And when that feedback happens, then all of these local champions that they have in the Maya community, within those local networks, then they can start to mobilize members around what is known. So for instance, if you have a practice that's trying to drive a health, trying to solve a health problem in that community, is diabetes, then if we just as one of the opinion leaders as public health, just go and give them literature without interacting with any of these people in this group, without understanding how to do any of this, we're just giving information to the informal network, then you can't expect that community to get activated and drive change. What you want to do is to create infrastructure so that you can get everybody in this loop on the same page, and when something happens here, everybody understands how to respond to it. Does that make sense? That's exactly what we're trying to do. So with the example of a doctor's practice, they sit in this box. And when I practice, I know my patient would go out and I wouldn't see them again until the next time. And I would be like, I wonder how well they did. Well, that can't be. I need to know how well they did. So anyway, that's all. I just want to put that 2 cents in, because this is what we're going to do. I mean, this is what the CCT is about. And we want to be sure that when we do something, when in the next several meetings, we talk about, well, what is this infrastructure? We're not going to talk about that today, but we are going to talk about it at some point. What is this infrastructure and how do we build that? So anyway, that's all I wanted to say.
Yeah, Dr. Carter, when I'm looking at this diagram, I'm like I'm like super pregnant right now, about to go out in the next couple of weeks and have this baby. So this is on my mind. But like something really interesting is happening right now also with these like opinion leaders and trusted voices. Like we've all seen it, right? It's in the news of the Tylenol in pregnancy, vaccines in pregnancy. And like I had this moment of being at the pharmacy trying to get I'm like, okay, well, what vaccine should I get? I know that the doctor recommended RSV, but I couldn't remember flu and COVID, like what was approved. And so the pharmacy said, well, they gave me 2 sheets of paper and said, CDC says you don't have to, maybe you shouldn't get it or you don't have to get it when you're pregnant. But ACOG says you should. And I was like, even me, like being who I am, working in this field, I had a second where I was like, well, what do I do with that? Like those are true trusted sources, right? And at the end of the day, everyone doesn't want to hurt their baby. Like it's your primary instinct is to not hurt your baby. So like it's such a problem right now to see the difference between, and this happened, I'm sorry, my thoughts are a little scrambled, but this happened during COVID too, where like initially, the Trump administration was putting out a lot of, information that was not science-based. And so it was almost easy for everyone to say, well, kind of disregard that, go from what CDC is saying and what your local health departments, state health departments are saying. But then once kind of Biden came in, there started to be like disagreement between scientists within the administration. And so the message got on a smaller scale kind of confusing. Like, well, who is the leader in this? And I think we're seeing the same things occur, and we've never been in a situation before where like the science may disagree with what CDC or HHS is putting out, and then who becomes the trusted, experts on guidance. Like you have these independent bodies like ACOG or whoever the physicians association is for that specific specialty. But it's like all boils down to these little decision points that people have that feel, at least to me, super overwhelming. So I think Dr. Carter is completely right that those informal networks are way more. I mean, they've always been important and critical, and really the number one thing that's going to determine what someone does. But even more so, I think your instinct when the experts are disagreeing is to be like, let me call my grandma and see what she thinks, or like, let me talk to somebody who has wisdom. And that is more so on the like informal network side. So it's just a really interesting time to be doing any type of health literacy type work, because it's just more chaotic than ever, I feel.
Well, that is exactly why we have to do this now. It was clear, it became clear, especially during during the COVID era, that it could be chaos, people fighting back and forth saying what you should drink this or you should do that. What we have to be sure is that these informal networks, the people you pick up the phone and call and you talk, that's your informal network. Those are your trusted networks. You pick up the phone and call, or you send a text, or you talking to them. These are the people you know and trust, and that's your network. That's really your trust network. You'll talk to them like within your trust network. Caitlin, you call me and say, "Hey, Doctor,
Yes.
what do you think about this craziness?" I'll say, "Blah blah blah." I mean, and that's because I'm in your informal network, because but your that's why it's important that your opinion leaders understand how to disseminate this information, and that they have whatever their voice is saying, that it has to go back and forth with your informal network. Like if your doctor said X, Y, and Z, and I said WXY, and your grandmother said something else, then you have to reconcile that. We have to give people tools how to reconcile. This is basically for the community. It's like, how do you get a community to critically think? Because you can't. It was very clear. You may not be able to rely on the CDC or something like that, but at the same time, a health department has the obligation and mission to make sure you improve the health of this community. So there has to be, in the community, there has to be a feedback loop, basically a trusted discussion, so that people in the informal network can come to a conclusion that then your champions in that community, that you're part of, that they mobilize. Then once that's established, at least we all know that, hey, whatever it is your conclusion it is, we're not going to take Tylenol in pregnant women. That's what we decided in our community, because we have decided, going through this loop and getting information, that this is not what's going to happen. Then they provide then the service pathways. They go to the doctors and say, doctor, this community this is Tylenol is not just going to work for us. Because this is outside our cultural beliefs, whatever. Then that doctor, who's one of the opinion, they have to know to abide by that. But when you go into your doctor and the doctor doesn't know your cultural beliefs or anything, and they're not listening to your local champions or whatever, and they're just prescribing Tylenol to you left and right, that won't activate. The community activation goes away. So that's why this is important. That's why we have to know, as public health people, how to activate a community, because we have to understand their formal networks, Who are they talking to? And how do we reconcile? How do we put in a system that can reconcile so that that particular community can improve its health? It may not go, it may say, I don't want to take Tylenol. Okay. But then what do we need to do for that community to relieve that pain? Because it's not, it doesn't have to be, I mean, just because something is mandated from, the research community or from the CDC doesn't mean that the community will follow it. But we have to, as public health people, we know we need to make sure they do something so that they don't go down the unhealthy pathway. That makes sense? So, I mean, this is a big job. This is we as a CCCT community that which we need to start to understand how to put that type of infrastructure in place, because we already intuitively know it. That's the thing. The beauty of this is that everybody on the call intuitively knows this is true. But how do you formalize it? How do you put it? How do you get these communications to occur? How do you make sure that the opinion leaders understand what's going on in the informal networks, and how do you make sure that the local champions, exactly know how the informal networks are where their thinking are, and are these service pathways that we are directing them to, are they right for them? All of that. That's why you have to maintain these feedback loops. And from an engineering standpoint, this is what you call the systems of systems problem. Because you got these different systems, these systems behave in a certain way. Like your opinion leaders, your pastor, he provides the service. He's pushing X, Y, and Z, but he doesn't really understand your informal network. You see what I mean? And so you want these different systems to start to interact, have feedback loops, so you can optimize this. And what are we optimizing? We're optimizing the health by activating the community toward healthier behaviors. Does that make sense? So that's why we're talking about this. Anyway, I'm through. I said I wasn't going to talk much. I'm not going to. I'm going to shut up.
Yeah, Sharon, you can come off of mute, and I see your hand is raised.
Yeah, I just had a comment and maybe, a thought about this, and it's really related to health literacy. And in our communities today, there are a significant number of people who don't actually have the tools to seek out information from credible sources. I'm not going to say reliable, I'll say credible. And then understand the information because it's not given to them in a way that's in lay terms, and then make decisions. And I think that the education of the community begins with kids, in schools, and looking at how health curricula, they can address some you brush your teeth twice a day kinds of issues, some of the behaviors, healthy behaviors, but they also need to address now, and build within people, right, within youth, the ability to reason through, sort through information, and guide them as to where to seek it. Because I don't think that, I know I wasn't taught those kinds of skills related to health and making good health decisions. If I weren't in public health, I don't know that I would have those skills at all still to this day. So I guess I think that someplace in the circle needs to be the responsibility of the community members themselves, and their building their capabilities.
No, I understand exactly what you're saying, Sharon. See, we're not, those tools that they need. You're absolutely correct, because that's part of building the infrastructure for an informal network. It's an informal network now. What's a trusted network now? We need to be able to give those members, because there are certain networks that have people in them who don't have tools to do all of those things, which I didn't have either. So we have to That's our goal. That's part of, once we recognize the elements, then that's what we are going to have to build. And we got to think through that. When you say those tools, well, what tools are they and how do you build them so that people will actually use them? And then will it really help those informal networks to be able to do the things we would want them to do? So I agree with you 100%. That's why that's for the next discussion, to talk about what is the infrastructure that needs to be in place for your informal network so that every member can participate and actively learn. When you talk about informal networks, you're not just talking about the adults, you're talking about everybody on the spectrum. Well, like for instance, one, I was in Houston, and they had all of the children were driving all of the behavior change. So when their grandmother or when they went to the store, they were the ones who say, these are the healthy foods and these aren't the healthy foods. They would be the ones who say, we're not buying that. It was just because that, but in their informal network, their children were activated. I thought it was wonderful, small community. I mean, so there are principles and things we can learn from other people, because if they in this country, we've done all kind of great things to do this work, but they're all in little silos. We don't know about them. We don't communicate with. Even when you go to the CDC meet, when you go to the APHA, they don't it's just, and everybody who's been there knows this. It's just you can't really decipher that out. We need to understand. We need to, as a CCCT, understand how we can do this and learn from the mistakes other people made, but also come up with some creative things that we can actually do. And the good news is that there are tools, information tools, that are rapidly being developed. We can leverage some of that. So anyway, I'll just leave it at that. But that's a good point, Sharon. Great point.
So rich discussion. This is so good. I'm excited. So we want to move on to question 2, but I do want to acknowledge Marlene's comment. She mentioned international actions, behaviors, and relationships that encourage safety, transparency, and cooperation among clients, families, and care teams. And also, Judy had a comment as well. Dr. Carter, that is so true. Tools to help people with reconciliation. And Caitlin did chime in and said, yes, we usually look for CDC for the official guidance. So, not to rush, but I want to touch on question 2. How have CCT partners been able to build and maintain trust with communities they serve? So, Jay, I would love to call on you because I know you've been participating and a member of CCT for a while. So, we'd love to hear from you.
I think Jay just said they have to run to another meeting.
Oh, okay. Oh, sorry. Anyone would like to step up and ask this question? Would like to be the first? I'm trying to look in the chat to call names. So let's see. Teller, would you like to call on someone?
Sure. I'm not sure who we have represented today from the community engagement and consultation group, but I know that CECG, they provide a lot of care coordinating services. So curious if they have any best practices to share or any challenges.
I think it's Amanda, because I see that she responded. Maybe she left.
Hello.
Hi.
Hi everyone. How are you?
Good.
So recently for us, regarding best practices in health, education, and wellness, we recently partnered with the American Kidney Fund. So we've been doing a lot of classes at the Aspen Hill Library every other Saturday, just teaching about how culture, with the things that we eat, nutrition, portion sizing, chronic conditions, how all of these things play a huge role into chronic kidney disease because everything connects with each other. They're like brothers and sisters. And we also are potentially partnering with another organization that's going to be having a diabetes event. So we're looking forward to that, to just spread the awareness and the word about what's going on in the community.
Amanda, did you say what community that you're interacting with or communities?
Yes, we're communicating with the Montgomery County communities and also Prince George's County, but mainly when we teach at the Aspen Hill Library, it's a lot of individuals that are in the Montgomery County area. And for those that cannot join us in person, we do also teach these classes virtually and in person. And we also do, a few fun games just to engage everyone. So we'll have like Jeopardy. So like for kidney health or diabetes nutrition, we'll say like risk factors for 100 or symptoms for 500, just to keep everybody engaged and to make sure that they're retaining the information that they're learning.
Thanks for sharing. I wanted to see if someone is on for CASA as well. I don't see Liz. Anyone here from CASA?
I'm not here from CASA. I'm a private practitioner, but I wanted to share something from my perspective.
Yes, absolutely.
Good afternoon. Is it afternoon? Morning? Good morning, everyone. So in my work, I'm also in the business of training practitioners, mainly mental health practitioners and therapists. And I think a part of building trust with the community from a very upstream approach is helping practitioners to internalize the idea that they may not be a the trusted voice in the community, right? So really helping them hone in on this factor of having to build trust and not just assuming that their degree and position and level of education makes them a trusted voice with a particular person that they are servicing at the time. And I think that level of awareness at the practitioner level really helps the practitioner to then increase their awareness of the influence of the entire client's network, as opposed to believing this kind of, God complex that they may have because we have certain information and access. And in addition to that, I also have supported, I lost my thought. That was a major thought. If the other thought comes out, I will share it. But mostly it is, also helping train practitioners in accepting the reasons why for particular communities they are not trusted and shouldn't be, right? So the expectation of blind trust is really deconstructed before they're actually working a lot with people, so that they don't further inflict harm. Because I think as health professionals, no matter in which level of health you're working in or area, we have to understand that the deep wounds caused by the healthcare systems in certain communities, which is why these, what we're calling informal networks, are very important and have been sustaining and the safest place for communities. And so also a little shift in nomenclature, because oftentimes as practitioners, we talk a lot about mistrust, but mistrust sometimes maybe unintentionally assumes that there's no reason for this, right? And so if we really shift to a distrust, it allows us as practitioners and public health officials to interrogate why and really appreciate it and incorporate that into any intervention that we deliver. And so I wanted to add that as a into the conversation. Thank you.
Thank you. I think that's a great point. Sometimes we do hear about the mistrust, and I like the word how you say blind trust. So I think it is important for the providers to understand why that's happening, what is the reason. And then we do see the value of those informal networks where people have somewhere to go back and ask questions and get opinions and kind of make those decisions to move forward. Dr. Carter, do we have someone else who would like to speak before I have Dr. Carter kind of give like a summary? And we only have about 10 minutes left, so I want to be respectful of everyone's time. But if we have any last comments, if not, I'll turn it over to Dr. Carter and then Sinead to do the community announcements.
Well, I appreciate you all being here. I'm gonna tell you, it's really important for us to engage all of you all in us formulating, what our next steps are going to be. Like, for instance, in talking about this, just to give you an example, when COVID hit, we health department did not really understand how to activate the community. I give Caitlin Murphy all the credit in the world because she actually went out there and did this. But what we learned from that is that, and what happened during the COVID event was we would go to these opinion leaders and we would tell them we would educate them and everything. But we didn't recognize anybody's informal networks. I mean, when we first started, we didn't recognize those at all. And the local champions, they were secondary to how we would approach things, although we've approached them also, but they were secondary, and the informal networks were tertiary. And that wasn't what worked. What worked is when you went to the informal networks, which Caitlin Murphy did at the time. She went to the informal networks. They called them pods. They brought people in who all knew each other and blah blah blah. And then when we went and created feedback loops, that showed that we had success with that. And then it goes away, of course, when the money goes and when everything else goes. But if we did that on a continuous basis, if we formalized it, if we put in those tools like Sharon was saying, that works in certain neighborhoods and with certain trusted networks and others not, then even if we lose funding, that can maintain itself. As a matter of fact, it can grow and scale up. And when those networks start to talk to each other, because everybody sort of lives in an area, although there are multiple networks there, but when those networks start to communicate, then and they are trusted networks, then trusted networks start to trust other trusted networks. And they are the primary source of change. When I say primary, not necessarily the primary source of information, of expertise, primary source of change. The expertise has to guide that. Then we're going to have something really special to move forward with. This is important. This is extremely important because this country does not allow that to happen. And then when we did have trusted networks like that, they've been destroyed at every change. At every time it gets to the point where it's there, they get destroyed for one reason or another, because everybody's looking at what winds are blowing above their heads. We have to make sure that at the core of that, we all who are struggling to survive and be healthy, we have to create systems that are going to do that. So I'm going to wrap it up by saying that's our mission. That's what we're going to do. We're going to, everything we're going to try may not work, but this is the core principles that's going to guide us: trust, communication, and formalization of these networks and then build infrastructure to keep them in that particular system. So I'll hand it over.
Thank you, Dr. Carter, and thank you, Tarnisha, for guiding this discussion and for everyone offering their feedback and their thoughts. We really do appreciate that. I know we have 8 minutes, so I'll kind of go through these community announcements fairly quickly because we do have quite a few. Autumn brings a lot of outdoor activities, so there's a lot going on in the county and a lot of really exciting things going on. So I'll share briefly some of those announcements and then we'll adjourn for the day. But I will send, as always, send the PowerPoint presentation with all the announcements as well after the meeting. So this Saturday is the last day to participate in the Prince George's County Health Department Back to School Vaccine Clinic. This last one will take place at High Point High School from 9 to 3. So if you still need to get your kiddos vaccinated, please feel free to attend this event to do so and share this with your neighbors and friends. MedStar Health is launching a diabetes support group for families and individuals affected by diabetes. So this will help promote healthy coping strategies, self-management skills, and just helping to establish meaningful relationships with healthcare providers and other support group members. So they're going to meet every third Wednesday of the month, and that will be at 11 a.m. They're also having their advisory task force meeting on September 29th at 4 p.m. They're just looking for us to come together to just review their implementation plan for their community health needs assessment. And they'll discuss some of the progress that they've made so far and any opportunities for potential partnerships and strengthening collaboration. Park and Recs is hosting their Walktober events. So you can visit the website on this slide, pgparks.com, for a list of all that they have going on. It's a lot of really exciting stuff, and I really encourage everyone to participate in their Walktober events. They are also observing Mental Health Awareness Week between October 5th and the 11th. So again, you can visit their website to learn more about the mental health resources that are offered in Prince George's County, and to just essentially gain more knowledge on how to take better care of our mental well-being. I know they're offering free workshops. They have some training, some fitness classes. So again, lots going on. So please feel free to join them in that. You can help us celebrate Maryland Walking Day by walking a few laps around the Tucker Road Community Center in Fort Washington. This will take place on October 1st from 4 to 6. You can register to attend. I think they're doing some urban line dancing. They've got some food and then another guided walk around the trail. So again, please feel free to visit the site for more information and to register. Girl Group will be hosted by Presley Counseling and Wellness. They're offering a safe, supportive space for young girls to build confidence, resilience, and connection. They're going to have guided discussions and activities. So that will be October 4th at 12:30 in Fort Washington. We're also excited to share information about the upcoming Medicare open enrollment event. This will be an opportunity for people to learn more about their Medicare benefits. They'll get one-on-one assistance. They can complete a benefits checkup. So it's a really exciting event, Friday, October 10th at 10 a.m. at the Health and Human Services Building. The Johns Hopkins University Bloomberg School of Public Health is also seeking to speak with Black Medicare beneficiaries in a 30-minute phone interview. There will be a $25 gift card incentive for anyone who participates, but they're really just trying to have a conversation to understand what influenced your health plan selection. So if you or someone you know is interested in participating, please feel free to share this flyer with them. In honor of National Substance Abuse Prevention Month, Therapeutic Links is hosting their One Future, One Voice Youth and Prevention Town Hall. It will be October 25th at 10 a.m. And essentially, they're just trying to bring the community together, particularly youth and their families and other prevention partners. They're going to have an interactive day of just conversation, learning, and just building connection through community. They'll have informational tables, a youth-led town hall discussion, and other family-friendly activities like raffles and giveaways and things like that. So sounds like an exciting event where you can learn a lot and contribute to your community. So if interested, please feel free to join them in that. The American Heart Association is having their Heart Walk on Saturday, November 1st. I think registration check-in is at 8:30 and the walk begins at 10. So if you are interested in participating in this 1 to 3 mile walk, please register to participate. We have a University of Maryland student requesting our participation in a survey that she's conducting on the relationship between personality and health behaviors. I don't know, is Jenna on the call? I'm not sure.
I don't see her.
Okay, no problem. The flyer and link are on the slide, and I'll make sure to share that out after this meeting. But we just want to thank you all for just supporting our future public health leader. So please feel free to participate in that for her. And then last but not least, we will be having our diabetes self-management program. This next cohort starts November 3rd through December 8th. They're going to meet every Monday online at 4 p.m. Diabetes self-management program is a great program. So if you or someone you know is interested, if you're living with prediabetes or type 2 diabetes, please consider registering for this free and informative class. Again, I'm very well aware of this. I worked with another health department that promoted this class, and we've gotten great feedback from it. But please note that registration is required because space is limited. And in these last minute and a half, are there any other community announcements before we adjourn? Well, hearing none, I do want to remind you that our next monthly meeting will be on Thursday, October 23rd at 11 a.m. Same place, same squares. And I look forward to seeing you all then. So you all have a great afternoon and a great weekend, and stay dry. Thank you,
Thanks,
everyone.
everyone.
Thanks, everybody.
Bye-bye.
Bye.
Bye-bye.
Thanks.